It may come as a shock, but I believe the most underrated treatment in psychiatry is the simple act of engaging in a meaningful dialogue with the patient. Unfortunately, numerous factors have led to the decline of this essential aspect of our profession. Psychiatrists today are burdened with administrative tasks and are confined by restrictive time constraints imposed by insurance companies and hospital administrators. These constraints have diminished the core of our practice, the genuine human connection through conversation. And what was once considered a revolutionary and defining feature of our profession, the biopsychosocial model, has now been simplified often into the bio-bio-bio model or the chemical imbalance theory, which really emphasizes the use of medications over a more holistic sense. And unfortunately, just due to the reality of practicing mental health care these days, there's often not time to talk to people. And because of that, doctors simply go to using medications, much more than other non-drug therapies. So due to these time constraints, we're seeing an emphasis on quick assessments and standardized treatments. And this has left really little room for the nuanced and individualized approach that patients truly deserve. Furthermore, the growing prevalence of mental health issues, coupled with a shortage of available providers, has forced a shift towards this more automated mental health care model. The way I see this carried out nowadays is that a lot of psychiatric patients actually just get their treatment in primary care offices. And this is just out of sheer necessity. And when you have primary care doctors who are seeing so many patients, 4 or 5 in a 60-minute period, patients become reduced to numbers on a depression scale. If they fill out the scale and they hit a certain threshold, all of a sudden they meet criteria for major depressive disorder and they're handed an SSRI without the doctor really understanding why they're suffering in the first place. There's none of this care that's really targeted to the root cause or the problems in the person's life, and it just kind of churns them out. Unfortunately, this approach lacks really the depth and understanding required to address the complexities of mental health problems. And it's evident that our current system is really failing both the patients and our practitioners. We need to really advocate for a return to the heart of psychiatry through compassionate listening, a desire to get to the root cause of the problems, having a thoughtful dialogue with the patients, and sometimes just supporting them while they go through something challenging. I think it's only if we start doing these things we're really going to reach people where they're at and address their mental health challenges. So that's my rant on what I think is the most underrated thing in psychiatry. Thank you for joining me and having this conversation with me.